Okay, so um, the other day I was going to work, and at my job, we decided that we were going to cut out leaves to decorate for fall. Basically, after cutting out some of the leaves, my fingers started to hurt, and I was like, dang, why are my fingers hurting? And then this theme continued throughout the day. Like, my knees would hurt, my fingers kept hurting, I was just in pain. Joint pain is one of those things that you don't notice until you have it, and it's one of those things that you take for granted until it's gone. So think about the most basic things like typing or like playing with your pets, or if you have kids, playing with your kids, or going out with your friends and just being able to move freely. We all have joints, and because of that, we're all vulnerable to having joint pain. Through research that I've gathered from sources from like Stanford and Cleveland Clinic, I've put together an overview of how joints are essential for our everyday life as they provide mobility, improve our quality of life, and our overall well being. In this speech, I will cover what they are and how they work, the most common types of joint problems, their causes, how to prevent joint pain, how to improve and maintain joint health. So let's give a quick anatomy lesson on what even are joints. Well, how do they work? Basically, a joint is anywhere in the body where two bones meet, and they can also be referred to as articulations. The purpose of a joint is directly correlated to its function, and they serve to provide structural support and allow movement. Here, I would insert my graphic on from my joints image. Okay. According to Cleveland Clinic, there are different types of joints and they're categorized based on their functions. So, for example, synarthrose joints are joints that don't move but provide structural support, such as the ones in your skull. There's ambithrose joints, which have limited range of motion and provide stability and some motion. And there's diarthrose, which are the ones that allow for the most motion and movement. The basic structural components of a joint consist of cartilage, tendons, ligaments, nerves, and connective tissue. And again, there are three categories depending on how much connective tissue they have. The first type are fibrous joints, which are not very flexible and composed of tightly woven connective tissue and containing lots of collagen. The second are cartilaginous joints, which allow for some movement, but and then there are synovial joints. These are the most common type of joints, and I would argue some of the most important type of joints, as they allow for the most movement and range of motion. And here, this in the picture that I have is a picture of a synovial joint of how its structure is, as they have fluid-filled sacs that are called synovial membrane, and those are used to space between joints so that they can lubricate and protect it. And there are 6 types of synovial joints. So, as you can see in the visual, the first type are hinge joints. So hinge joints are easy. They're the ones that open and close in one direction. For example, take in your knees or elbows. There's also ball and socket. These are basically like what the name says, like a ball, and it fits into a socket and it can rotate in almost any direction. For example, this are your shoulders or your hips. There's condyle joints, which are two oval-shaped bones that fit together, similar to ball and socket, but can't rotate 360 degrees. So like your wrists. There's also pivot joints, which don't move, which rotate in place but not from their original position, like your neck. Planar joints, which are two bones that slide over without rotation, for example, like your vertebrae, your spine. And then there's saddle joints, which we love saddle joints as they're in a U shape and provide movement in directions and allow for things like opposable thumbs. So, joints are very important, and it's estimated that we have about 250 to 350 in total in our body. So what are some of the most common joint problems and their causes? Well, the first one is arthritis. According to the University of Iowa Hospital and Clinics, arthritis, there's various types of arthritis, and basically it causes joint pain and swelling, and the two most common types are osteoarthritis and rheumatoid arthritis. Osteoarthritis is the most common and it worsens with age and it includes things like pain, stiffness, tenderness, and loss of flexibility. Rheumatoid arthritis, on the other hand, is an autoimmune disease where specific cells in your system attack the joint lining tissue. And it also has similar symptoms to osteoarthritis, also affecting the fingers, hands, wrists, knees, toes, feet, ankles. But the difference is that this one has different onset ages. It's typically also between 30 and 60 years, but it can also occur in children and adults. Um, and other things can lead to arthritis or cause other things that aren't arthritis can cause joint pain. For example, lupus, which is an autoimmune disease and not a form of arthritis, but it can lead to arthritis as a symptom leading to joint pain. Genetics also play a large role in how likely you are to develop it, as if you have family members with arthritis, you're more likely to develop that in the future, and females are also more likely to develop it than men. Other causes are injury. Other causes for joint pain are injury, for example, sports injuries, such as overuse for running or repetitive movements, for example, in sports like tennis, where you're constantly moving your arm in the same motion. Sprains and dislocation are also factors. And then your lifestyle. There's a quote, there's a phrase that goes, use it or lose it. So basically, for example, if you're very sedentary, you will likely develop joint pain and start to lose your mobility. Also, testing to determine the types of joint pain and what causes it. There's different tests that can be done, including x-rays, ultrasounds, and CT scans. But with all these ailments, how can we maintain strong and healthy joints? Well, in order to improve and maintain joint health, the first thing that you should look for and to do is nutrition. So having a healthy diet, which consists of adequate protein, omega-3s, calcium, and vitamin D, is very important. Protein helps to repair and build connective tissue, which will lead to stronger joints. Omega-3s reduce pain and inflammation by keeping your joints lubricated. And examples of where you can get omega-3s are, for example, fatty fish like salmon, chia seeds, and eggs. Calcium is important for your overall bone health and reduces the likelihood of joint deterioration, which can cause osteoporosis. And then vitamin D3 is essential because it is what it absorbs that calcium, and it also has anti-inflammatory properties helping to reduce pain and inflammation. You can also look into supplementation. According to the Stanford health article that I was reading, glucosamine is a popular supplement, which is a natural compound found in cartilage and can be bought at the store, and you can take it, and it's meant to help with your joints, as well as fish oil for those who struggle with getting enough vitamin D, vitamin omega-3s, and just taking overall multivitamins. But as with everything, I'm not a medical professional, so consult your doctor first before you start to take any types of supplements. Another thing you can do is exercise and movement. Exercise, especially low impact exercises, are very good for joint health as they minimize the amount of stress and pressure that is put on your joints. Examples of these are like swimming, cycling, and yoga. And it doesn't have to be anything aggressive, and you don't have to be doing it every day for hours, but just 30 minutes a couple times a week can really help. Also, focusing on your form, specifically when you're weight training, can help with joint health as it decreases the risk of injury. And stretching. Stretching improves your flexibility and range of motions, as well as lubricates your joints because it releases synovial fluid. Here I would insert the 30-second clip of the stretching video. Also, maintaining a healthy weight is good for relieving joint pain, as maintaining a healthy weight reduces the stress placed on your joints, and regular checkups, especially if you're experiencing pain, as those small things can lead to big things in the long run. Overall, we all have joints, but we often forget about them until we find ourselves in pain. We went over how joints work, what they are, most common joint problems, and ways to maintain and improve our overall health. Everyday life revolves around movement, and even the most basic of movement is crucial to just surviving and being happy. So when we take care of our joints, it leads us to lead happier and healthier lives. Thank you.